Welcome. This is your orientation guide. Here in Isolation Unit, we offer the best healthcare for you and your family because your health is our priority. In Isolation Unit, all rooms are specifically designed with negative pressure to accommodate patients with infectious diseases requiring isolation. As a healthcare team, we dispense comfort, compassion, and caring even without prescription. These are the healthcare workers that will help you during your hospital stay: physicians, nurses, clinical dietitians, patient educator and social worker, patient relation officer, nursing clinical practice, radiologist, infection control officers, pantry workers, laundry workers, security officers, maintenance officers. Welcome to Isolation Unit of King Abdulaziz University Hospital. Isolation rooms are special hospital rooms that keep patients separate from other people while they receive medical care. Isolation rooms are needed for patients who have certain medical conditions or infections, often in the skin, the lungs or airways, or the intestines. Anybody who visits a hospital patient who has an isolation sign outside their door should stop at the nurse's station before entering the patient's room. This is the front door of each isolation rooms. Each room is allocated with numbers. It is also equipped with a device to advise when pressurization has not been achieved. This is the isolation precaution board to indicate what precautions to be followed by the visitors. A hand rub is also available for hand hygiene. Each room has anteroom, which you can see your loved one without going inside. You can wear and remove your gloves and mask here after patient contact. It is also allocated for hand washing. Inside the patient room, there's an electric bed with a call bell to call the nurse, a telephone, a refrigerator, television for your entertainment, a cabinet to store your belongings, and a curtain for your privacy. A bathroom is available also for your own convenience with emergency call bell. Each room is connected to oxygen source, and suction machines are mounted to the wall. Please obey the following instructions while staying in the isolation room. Stay inside your room and keep the door closed all the time. Electric fan is not allowed to use inside the room as it will affect negative pressure. Air condition inside the room is not adjustable as it will affect the negative pressure. Please don't smoke inside the room. We will refer you to smoking cessation clinic as needed. Let your family bring your valuables back to home. If needed, take care of your own belongings to prevent losing them. And familiarize yourself with your rights and responsibilities while in the hospital. Wear all the ID bands that were given to you for proper identification. Ask your doctors and nurses for any concerns and doubts of your treatments. To turn on the lights above your bed, press the light button in the call bell. You can also press the switch beside your bed for a brighter light. These are the buttons that you can press if you want to change your position while on the bed. You can sit by pressing the arrow up button, and you can lie down by pressing the arrow down. Your family can visit you every day from 1 p.m. to 2 p.m. Only one visitor is allowed at a time during visiting hours, wherein they need to wear the mask provided for them by the nurse throughout the visiting hour. And children are not allowed inside the unit as a visitor.